And good morning. It's always a pleasure to have Karen Onen with me, and she is from the East Central Regional Transportation Coordinating Council. I've said it before, I'll say it again. We've been getting together a couple times a month here, basically for the past year almost. Yeah. It's really been nice to get the information out to our communities about what's available for people when they need a way to get around. They need transportation. And there are so many options, there really are. But Karen's piece is to try to help get more options and connect the dots. And we've had a lot of really interesting conversations. And this morning, Karen, first of all, good morning, my dear.
Good morning, Robin. Nice to talk to you.
Love having you in as always. And we get two for the price of one today, basically.
Yeah.
Right? So I'm going to let you introduce our guests this morning.
Well, today I'm so pleased to be able to introduce to you Natalie Mathewson. She is with the Central Minnesota Council on Aging, and she is the Community Development Supervisor. We also have with us Wendy Galanius, who's the community specialist with the Senior Linkage line. And they work together, and I think this talk we'll have today will really inform you on what's going on with the seniors and how you can learn more about how to deal with situations in your family or friends that are seniors. So without further ado, I would like to introduce first Natalie. Hello.
Hi, Karen and Robin.
Welcome, and thank you for being here today.
Thank you for having us.
I'd like to ask you a little bit about your background and how you got involved in your profession, as well as your connection with transportation.
Absolutely. So I've worked in the long-term care and human services field for about 26 years. Prior to moving to Minnesota about 8 years ago, I was living in Colorado, and I had worked doing case management as well as mental health counseling and working with nonprofits in Colorado, contracting with the state of Colorado to do some of the home and community-based services, Medicaid waivers for case management and assistance. So I've worked with all the way from newborns up to individuals over 100 years old. When I moved to Minnesota about 8 years ago, as I said, I had an opportunity while working in Colorado Springs, Colorado, to partner with the Area Agency on Aging there. And I really liked the mission and the work they did, so I reached out to Central Minnesota Council on Aging and started working with them as a contract manager and then community development. And so I'm very passionate about working with our providers in the community and those who serve older adults and those that care for them. Mm-hmm. Regarding transportation, I mean, my whole career, transportation has been right up there with a major need for all ages that I work with, especially older adults. And it's not unique to Minnesota, the need for transportation. So when we look at community members accessing services, whether it's to shopping, social items, going to church, going to concerts, transportation is key for them to get there. And once an individual either is not able to or chooses not to drive, then they need to figure out a way to get there using the transportation services. So It's been a very big key part of my career for sure.
Definitely a challenge.
Can I ask you really quick, Natalie, when you said Central Minnesota Council on Aging, so does it cover what you're doing cover the entire state of Minnesota or a region?
No, we actually are one of 6 area agency on aging in the state of Minnesota that's designated by the Minnesota Board on Aging, and we actually work with 14 counties in the central part of Minnesota.
Okay, I just wanted to get kind of that idea of the placement and all that.
Yeah, so our RTCC region is in her region.
Why don't we segue over and let's go ahead and talk with Wendy. Wendy, talk about your piece, your background, and your connection to the Senior Linkage line for us.
Yes, thank you. I began working for the Senior Linkage line about 9 years ago now. Prior to coming to work for the Senior Linkage line, I was a nursing home social worker for a little over 20 years, primarily within the nursing home, working on discharge planning and people who came into a nursing home setting for a short-term rehab for various reasons, coordinating transportation to get home, get to doctor's appointments, get groceries once you're home as you're still in that recovery phase. I began working with the Senior Linkage line for a newer service called Return to Community Initiative, which specifically focused on assisting private pay persons leaving a nursing home that may have complex or multiple medical and physical needs that express the desire not to be a long-term care resident in a nursing home, but to actually return back to their home community, whether that was in their home or apartment or looking at an assisted living placement that may be able to meet a person's needs. So most of the people in that situation are not able to drive anymore or need to recover a little bit further along in order to get back to their driving privileges. So when looking at my role as the community living specialist is to not only look at transportation, but getting the mail and who's going to do cooking and cleaning, and are you able to manage your medications? What about assistance with transferring, toileting, bathing, dressing, grooming, all of those daily needs? So becoming a community living specialist, I had knowledge of some of those resources in the community that could help out the senior population, but I really needed to beef that up and look at the more intricacies of a daily life of an elderly person returning home from a nursing home.
When you talk about the private pay, that is the missing link in my mind, because there are more services available if someone goes onto Medicaid and those kind of things. There's much more available than if somebody doesn't fit the financial criteria. And so I'm so glad to hear that that's something you're working on, because I think that's been a real issue for some people that don't fit. It's kind of like they're left out, don't necessarily have the help that's needed. So I'm really glad to hear what you're doing and that you're trying to fill that void.
And you bring up a very good point for those persons who may be on a financial assistance program through the county. They automatically get that case management service and that person with that knowledge and that background to set up services, that kind of thing. And that's exactly what this community living specialist position under the senior linkage line blanket was. What about the people who are private pay? Mm-hmm. They need that case management as their aging issues become more prominent.
Mm-hmm. I want to ask both of you, as people now have gone back to their normal lives after the holidays, and they have seen their family members and realize that maybe one of their parents needs help. I see that Dad's having trouble hearing more than I thought because I haven't seen him in a year, or he's having trouble moving, or we don't think he should be driving anymore. These kind of things as our family members, our parents get older. What would you suggest a person do when they have questions about what can they do for their parents?
I guess this is Wendy. My first go-to would be calling the Senior Linkage line, which is a free information and referral source for all Minnesotans and their loved ones. The Senior Linkage line provides free, neutral, and objective information about local resources available to address an older Minnesotan's needs, whether that be one need, 4 needs. It is funded by both state and federal funding dollars. The Senior Linkage Line call center staff are trained in long-term care options counseling. One of the things that we're trained on is to listen to the caller and what the person is calling in for and provide information, referral support for those specific identified needs, but also to ask probing questions about what maybe some other needs are, and that's where the transportation can come into play. But the first goal of the long-term care options counseling service that the Senior Linkage Line provides when calling in is to assist a person to age in place for as long as possible and remain in their home community where they have chosen to live, instead of saying, well, if you moved, you could get all of these services available to you, but really taking a look at how to support a person in their home community is the value of the long-term care options counseling services, which provides a lot of information and resources in several different areas of an older person's needs. We are the State Health Insurance Assistance Program. We are the Senior Medicare Patrol and the Aging and Disability Resource Center. So we cover a multitude of topic areas. We are able to help any person on Medicare answer Medicare-related concerns, billing issues, possible fraud, what are my benefits, I'm new to Medicare, I don't know what I'm doing, I need to choose a Medicare Part D drug plan, I don't know how to enroll. There's just so many questions that go along with that Medicare health insurance piece that the Senior Linkage Line are knowledgeable staff that can assist a person in providing information that's going to work for them, help them make a choice on their own, but also help enroll in those programs, which can sometimes be the toughest part of that Medicare process.
Oh, I was just going to ask, when, say my father lives in Florida, is there such a senior linkage line or something like it down there? I mean, if I've got issues and I live in Minnesota, but I see him as failing down there, how would I handle a situation like that?
What you could do, Karen, is you could start with calling the Senior Linkage Line here in Minnesota. Mm-hmm. But one thing about it is in the United States, there are area agency on aging, regional based in every state, that are governed through the State Department, usually Aging Services Department. Wendy mentioned the ADRC, which is the Aging and Disability Resource Center. So I do that. Wendy does that. We often get calls from family and friends who are from other states. I don't know if every state has a Senior Linkage Line type of toll-free number, but every state has an area agency on aging or aging system that people can call and get connected to the local and regional service providers.
And we'll just drop in here that the Senior Linkage Line phone number to remember is 800-333-2433. Again, 800-333-2433 for the Senior Linkage Line.
One of the other things that Minnesota has, and it's really becoming more prominent across the country, is caregiver support programs. So with the Central Minnesota Council on Aging, as with all of the 6 area agencies on aging in the state, we have grant administration of older Americans Act Title III funds, and there's different areas of services. So if you call any of the area agencies on aging across the country, they'll have the similar types of program services, one of which is caregiver support services. So for example, like the scenario you gave of your father, say, living in another state, and you're trying to help him and kind of care for him from afar. You live in Minnesota. You could still call the Senior Linkage Line and maybe get connected to a caregiver support specialist or caregiver consultant, and they could help you find access to services as long as either yourself, who is the caregiver, or someone who's receiving care lives in the state. They can receive the services, and as long as one or both are 60 and older or have a disability, whether it's a cognitive disability or physical disability. So that's another option to call here locally and work with a caregiver support program. So for example, out in our eastern region, we have Family Pathways, who provides caregiver support services.
Okay. I wanted to also ask about, there's a couple other linkage lines too, the Disability Linkage Line and the Veterans Linkage Line. Would you want to mention anything about those?
Yes, the Disability Hub provides information and assistance to those people who are under 60 and disabled. They are a sister to the Senior Linkage Line and can be reached at 866-333-2466. There is also a Veterans Linkage Line for any veteran across the state of Minnesota, and they can be reached at 888-LINK-VET, which is 546-5838.
I will also add those links for anybody who is interested and who is listening right now. So you could just go to eastcentraltransit.com and find that information easily. Natalie, especially because you're with the RTCC, do you have any more to say in regards to transportation and seniors?
As I mentioned before, most of my career, transportation has been really a big priority area wherever we are, especially, here in Minnesota. But it's not just Minnesota, it's really across the country. And part of my reason for working with you, Karen, with the East Central Regional Transportation Coordination Council, as well as Local Human Services Transit that we're working on for the 3-year plan, is finding a solution. We hear here's the issue, or here's the issue, or here's the issue, but I really appreciate the conversations and the collaboration that's happening to let's think outside of the box and let's think about what can we do to solve it. And so I know for transportation, for example, I have told you before I live in Kanabec County, and they have a good transportation provider, but I chose to live in a rural part of Kanabec County, which there's a lot of it, and I'm outside of the transportation area to get transportation. I do not need transportation right now, but how can we do a better job connecting maybe our transportation providers, offering, easier access for the providers to work together, and then also make it for a better experience for those utilizing the transportation services. Mm-hmm. We have mentioned before in the past that if someone needs to go to different counties, it might take them hours to do it. I had a neighbor recently whose family member was needing transportation to dialysis, and it was outside of our region and the county they lived in, and they couldn't find it. So they ended up just finding a private friend or family member, and they paid them to go. So I think it's really looking at what we have for our regulations and how can we work better together to then help our consumers who need the service.
If we can help the seniors, we help everybody. So this is a process that we're working on together, and I'm so glad that we've got you involved with the RTCC. You have such great input and insight. I think all of us working together, like us all being at the table together, but virtually by Zoom these days, but we're all there talking, and all the providers are there at the table. I don't think this has ever been done before, that everybody is talking about this together. So I just want to say thank you to both of you. Is there any more that you would like to say that we've missed?
Karen, I just would like to mention that the Senior Linkage Line has been in existence for over 25 years in the state of Minnesota, serving all 87 counties through that toll-free number. Mm-hmm. And transportation has been in the top 10 topic areas of a reason why people call into the Senior Linkage Line for several years. Mm-hmm. Because of those holes and the ruralness in our 14-county area in which we live, there are excellent transportation options for those people in a city. There it be a taxi or public handicapped accessible low-cost public transportation, or specifically medical transportation that's wheelchair accessible that may be at a higher cost. But the fact is there are many rural areas across the state that are underserved. Mm-hmm. So I'm so appreciative of the work that is being done to really bring this information to the light and to really research those gaps as our Minnesotans are aging.
Well, we're all so passionate about this. We want to help others, and we're all going to be there at some point. I'm really excited to have gotten to know you, Wendy, and glad that we have a good line of communication, and I'm learning more about what's needed, and filling those holes in the rural areas is what the RTCCs are all about. It's going to take a process. It's going to take time. The more tools we have in our toolbox, whether it be Lyft or, whatever we can find as options, the better.
Talking about collaboration and working together, as I mentioned, we work with 14 counties, and we have a board of directors that is made up of county commissioners from all 14 counties. And we also have an advisory team, and that is an awesome way to basically bring to the Council on Aging and those connections of the needs of the community. And we actually have an opening on our advisory committee in Kanabec County. We have a need. So if you know of anybody who would be interested in joining the Council on Aging Advisory Council, we're taking applications right now for that. And that's a great way to be able to provide input of what you're seeing in your communities to try to help us work together on improving the services for older adults.
What would be the best way, Natalie, if somebody's hearing this, pass along they might be interested? Is just call you, or what's the best way?
Well, actually, if they go to cmdoa.org, there's an application there online. Our direct number is 320-253-9349.
Well, again, I so appreciate everyone's time this morning. I want to make sure that we mention that this is being funded in part by MnDOT. I need to mention that as well. And Karen, if you want to just let the ladies know how much you appreciate their time today.
Yes, I'm so happy to have you both on. Thank you so much for all of this information. And again, let me say that you'll find this podcast along with the information that we've talked about, the links and phone numbers, on our website, ecentraltransit.com. Thank you guys so much for being on.
Thank you.
You're both. Thank you.